Hi, I'm Dr. David Ellison with Regen Medical Centers. Today I'm going to show you how to do a testosterone injection. I'm going to show you the supplies that you need. I'm going to show you how to draw up the medication, and then we're going to switch over and have a model come in, and then we're going to show you how to inject. Obviously, you'll need your medication. That's first and foremost. You will need a syringe to inject. I have 2 needles here, one to draw, one to inject, and I'll tell you what kind of needles you'll need. Alcohol pad, gloves, bandages, and either a 2x2 or a 4x4, and finally a sharps container. Our model today is not on testosterone, so we don't actually want to inject testosterone into him, so we're just going to use saline, but we'll pretend that that's your testosterone. The first thing you do is remove the cap. Now, even though this is a fresh bottle of medication, still be sure to clean the top off, because you never know. It should be sterile, but you never know, so just to be safe, clean it off. So take out your alcohol pad and rub that over the top, and be thorough with it. You don't have to be obsessive compulsive, but don't just rub it once and then stop. So make sure it's saturated with alcohol. Now, alcohol works by its drying effect, so it kills bacteria and the germs by drying. So if you're in a hurry, you can kind of air it dry. If anything else touches that stopper, you have to go back to the beginning, make sure you clean it off again. So set that aside. So while that alcohol is drying, take out your syringe. This is a 1 cc Lorlock syringe. So 1 cc refers to the volume that it's going to draw up. It's a pretty small volume. The fact that it's Lorlock, I'm going to show you here in a minute. Testosterone cypionate or other forms of testosterone are very viscous. They're made with an oil. So if you just put your needle on a regular syringe, the back pressure can cause the needle to pop off. A Lorlock syringe works like this. Instead of just putting the needle onto the syringe, you actually screw it on. There's a mechanism to screw it, holds it in place. No matter what the pressure, you can't pull that needle off of the hub at this point. So now we pop off the cap, put the cap aside. Now we're going to draw the medication. So remember, I told you had 2 needles. I have a large needle to draw that we're going to discard and not use after we draw up the medication, another needle that we'll use to inject. So I'm going to draw the medication. Again, very important that you don't touch that stopper. And then periodically what you have to do is draw some air. As you draw medication from this over and over without displacing it with air, you can create a vacuum. So we put a little bit of air in there. And let's say your doctor told you to take a half of a syringe. So we'll draw this up like this, and you may notice that there's a little bit of air in there. So I overdraw just a little bit. I push it back into the bottle until that air is gone, and I pull it back down until I'm right on the 0.5 cc mark or the half cc. Turn it back and then pull that out. You can set this bottle aside. Okay, now we have to get this needle off of here. You have to be very careful. Never ever recap a dirty needle. So once this needle's been in you or someone else, not a big deal if it's in you necessarily, but just get in the habit of not recapping dirty needles. But with this, if you're extra careful, you can drop that cap over the top of it, grab it from the bottom and twist off. Otherwise, just use your hand and you can kind of force that off. Take your needle, put it into the sharps container. Now we're ready for our injection needle. So with testosterone cypionate, you're probably, if you do inject or if you're beginning to inject, your doctor has prescribed a much larger needle than what I'm using. Today our model is going to inject sub-Q, meaning it's going right underneath the skin, and he's not going to do it intramuscularly. Testosterone is usually prescribed to put into the muscle, but today we're going to put it into the fat, so we're using a smaller needle. But I just want you to get the concept and the understanding of how it's done. So this is ready to go. So this is where our second alcohol pad comes in. And if you're injecting yourself, the gloves are not so important, but if someone is injecting you or if you're injecting someone else, be sure that you wear a pair of gloves. So we've already drawn up, we have the needle that we're going to use. Now there's a little air in there, so what I do is very gently, if you push that, you can push all the medication out. So very gently get the air out of the hub, and you do that just by pushing and watching a little dot, little drop of the medicine come to the top and surface, then you're ready to go. The next step is to know which area you're going to inject into. Now, if your doctor has told you to put your testosterone into the muscle, you're either going to sit down and put it into a thigh muscle, or you're going to put it into the backside, what we call the gluteal muscle, into your butt. So again, that's a personal preference, how you like to do it. In my experience, most guys like to put it in their backside. It's a little more comfortable, but today Mark's going to do it in his abdomen right underneath the skin. You can just expose a little part there. Mark, I'm going to let you clean your area. So an area about the size of a silver dollar. Now again, so that area is now sterile, so if anything touches it, if he drops his shirt, he touches it with his hand, he needs to go back and start over with the alcohol. So Mark's right-handed, so he's going to inject with his right hand. With your left hand, Mark, take your skin, pinch it out, because otherwise, if you have not a lot of fat like Mark does, if you put it right in without pinching, it's going to go into the abdominal muscle. So you pinch just like that. Make sure you're in an area where you've cleaned. Go ahead and put that needle in. There you go. And he chose to do it very, very quickly, which is fine. Kind of like taking a bandage off. If you do that though, make sure you're accurate. Make sure you don't stick your finger. He's injecting at a very good rate. Now this is just water he's injecting. If it were testosterone, he'd have to apply much more pressure. So understand that is the first time you give your testosterone, you may feel a little resistance to it. As long as you're not experiencing pain or you don't see a large bump developing where you're injecting, and you can just put your needle down. So now grab a 2x2, just clean off that little bit of blood, and that's it. That's how you give a testosterone injection, any sub-Q injection for that matter. Don't let someone else clean up after you. That's how needle sticks happen. As careful as they might be, there might be 2 needles, one they didn't know about, they get stuck. Drop that right into the sharps container. You can close that up. The rest of this can go into the garbage. Even 2x2s and 4x4s, if they have blood on them, you can still throw those into the garbage. You just can't throw large volumes of blood into the public garbage system.